What if the food on your plate was the right food at the right time? Could actually help reverse the very condition your prescription is trying to manage. I had a patient once, and she came to my pharmacy every single month, metformin, then a second medication, and then a third. And every month she'd look at me and say, Dr. Remi, why isn't this working? And the honest answer, because no one has ever talked to her about insulin resistance. No one had told her that her blood sugar wasn't the problem. It was the symptom. And no one had shown her that food, sleep, stress, and movement could do what three medications couldn't. So today, that changes. My guest, Dr. Raymond Ladele, is a holistic diabetes care specialist, and he's going to show you exactly how to address the root cause of type 2 diabetes, not just the number on your lab report. This episode is for everyone who's ever felt like diabetes was a life sentence. It's not. So stay with us. So, welcome to When Food Meets Medicine, the podcast where we explore how you eat affects how your medication works and how your health thrives. I'm Dr. Remi, a pharmacist, a clinical educator, and your guide at the intersection of what you eat and the medications you take. I believe that most powerful medicine is often the one you never have to take because you address the root cause first. So today we're talking about diabetes, not just how you manage it, but how to reverse it, how to address the root causes like insulin resistance, inflammation, stress, sleep, and nutrition, and how food, real food from real kitchens around the world, can do things that medications alone cannot. My guest today is Dr. Raymond Ladele. He is a UK-based general practitioner and primary care diabetes lead in Coventry. Working across primary and secondary care, he runs specialty diabetes and weight management clinic at Dr. Finley's private practice. He's a Diabetes UK clinic champion and an advisory board member for Diabetes Africa, which speaks to the global breadth of what he does. Dr. Ladele, welcome to When Food Meets Medicine. It's a genuine honor.
Thank you so much, Dr. Remi. Thanks for having me. It's an honor.
Okay. Today we'll be talking about diabetes, and Dr. Ladele will be talking more on what we need to know. As a pharmacist, I see the conventional approach every day. Metformin could be a second drug or third, and those medications work. But they manage the fire, not the source. They treat the symptom, not the cause. So let's start there. From your frontline experience, what is the standard approach to diabetes consistently missing?
Thanks for that. So, diabetes, I would say, is one of those conditions that your lifestyle plays a significant role in, one, preventing the occurrence of diabetes, and two, actually managing it when you do have the diabetes. But more importantly, you could actually reverse the diabetes diagnosis with some lifestyle changes. So yes, medication has its role, but the key thing is actually about lifestyle and has to do with diet and physical activity. Specifically said physical activity, different from saying exercise, because when you say exercise, people think about, going to the gym and, pumping, the weights and all that and going on the treadmill and all that. But physical activity encompasses that and many other things. Back to your specific question in terms of, the real cause of why people get into diabetes. I think it's very important for me to say that there are two major types of diabetes. There's the type 1 and type 2 diabetes. For the type 1, unfortunately, lifestyle changes, though very important, is not enough to manage type 1 diabetes. But by far, the most common type of diabetes, which accounts for about 90% of diabetes across the globe, is due to type 2. And type 2, lifestyle, i.e., your diet and your physical and physical activity, plays the most important role in how you prevent, how you manage, and potentially how you can reverse the diagnosis.
Yeah. That makes so much sense. And I do want everybody listening to hear this clearly. Medications help. They do save lives, but they don't fix the root problem. They help manage it. So let's talk about what's really happening in the body. Can you walk us through what insulin resistance actually is and
Okay.
why reversing it is, sorry, go ahead.
Go ahead, finish.
And why reversing it is central. It's a
Yeah.
central goal of everything we're going to talk about today. So go ahead.
Okay. So yes. So I think I will be talking more about type 2 diabetes here.
Yeah.
So type 1 diabetes, just to quickly just say what it is and park it, because I think
Okay.
the discussion we're having today will mainly have to do with type 2 diabetes, where insulin resistance comes into play. For type 1, there isn't resistance. There might be a bit of it, but the main thing is there's insulin deficiency. So your body, your pancreas, which is the organ that produces this particular hormone, which helps us to utilize sugars, doesn't produce enough insulin, usually due to some what we call autoimmunity. So the body fights or kind of, starts to fight against itself. So let's park that,
Yeah.
because that is different from type
Type 2.
2, where insulin resistance comes into play.
Okay.
So for type 2, you do have enough insulin, at least for some time, whilst you're the early phase of the diagnosis. Later on, you might require insulin because it's become deficient. But at the early stages, there is insulin resistance mainly because of the fat deposits around the body, especially with what we call visceral fats. So there is there are lots of theories out there. It's not just about the fat deposits, especially within around the pancreas, around the liver, that results in this insulin resistance, but there's also some inflammation that comes into play. But the main thing is, if you have lots of fat deposits around your organs of the body, it becomes very difficult for the insulin that is being produced by your pancreas to actually open the gates, as it were, from, for the glucose to go into where it's needed. So, the cells, the muscles and all that, because the fat kind of becomes like a gate that is kind of blocking it, and then have that insulin resistance. And what then happens is that the body then thinks, oh, there's not enough insulin, and then it produces more insulin out. So it's like a vicious circle. The body is revving a lot of insulin out into the blood, but it's not just able to do the job because of that resistance. And mainly that is because of overweight and obesity. That's why obesity and overweight and type 2 diabetes are so interlinked. So it's very important that one actually looks at the source, as you said, which is insulin resistance, mainly apart from inflammation, but mainly because of the lots of fat deposits, visceral fats
around the body.
body.
Okay. So I really like the way you explained it. I think a 3-year-old would understand. And I think what I do want everybody to hold on to is reversible. Can you share a patient story, someone who's reversed their diabetes or significantly reduced their medications through your approach, or through what you do? Yeah.
Absolutely. So I have many stories I can share. The one that comes to mind, it was just literally 2 months ago. So this patient is actually a doctor. So he is a junior doctor, and he comes to my GP surgery just for routine. So in the UK, once you turn 40, encouraged to have like what we call an NHS health check. So you just do routine bloods, mainly your kidney function, liver function, and very importantly, a diabetes check, which we use what we call the HbA1c. So he had this blood test about 3 months ago, just because, not like he had symptoms of diabetes. And it's important to say here that a lot of people might present with no symptoms. The main symptom you get, especially in type 2 diabetes, is you get very thirsty, you're weighing all the time, and you get tired all the time. So those are the common ones. But you can get few other things, like you're always getting infections like bladder
Lung
type
infection.
infections, or balls and few other things. But the common ones are what we call: you're very thirsty, you're drinking lots of water, you get tired, and some people actually lose weight, but that's usually when it's even progressed more. So this chap came with no symptoms, just a routine check, had his HbA1c tested, and it was high. So we use millimoles per.
So when you say high, because we're going to
Yeah,
talk about what's high, what's a high
so
number?
high. So that's what I was trying to say. So we use the unit we use in the UK is millimoles per mole, which from 48 and above, you have diabetes. Okay. 42 to 47, we say you have pre-diabetes. Just saying, red flag, you need to start doing something. So he had his own HbA1c, which is the test for diabetes, was 70. So way above the 48 mark. So so he was shocked. And, as a doctor, he could understand, what's this
Couldn't
about?
believe it.
And he couldn't believe it. So it's like, oh, I don't have symptoms and all that. I said, yeah, yes. You should know that sometimes you will present without symptoms. But he was because he kind of understands the consequence of this and all that. But we tend to repeat before we say, oh, you have diabetes. We normally do a second test.
Okay.
Because yes, although most of the time lab errors are not common, but before we put that diagnosis, a lifelong diagnosis, on somebody's neck and say you have diabetes, we usually check again if they don't have symptoms. Now, if he had symptoms, like I earlier said, straight away we diagnose the person with diabetes, and then we start looking at ways of how to manage it.
Okay.
So he didn't have symptoms, so we needed to repeat it because he himself was in shock and he was in a bit of denial. Like, look, I don't expect something to just change.
At all.
So he kind of understood that, okay, it's 70 is too far from 48 to say, oh, this is a spurious result. So what we did is, because usually we would repeat it in a couple of weeks, but he was like, oh, I need to do something about it. And that I shouldn't diagnose him yet. I said, yes, of course, we need a second test. But he said, can you hold fire with the second test first? What can I do? So I said, okay, what's your diet like? And he's very active, but his diets is mainly carbs, very high carbohydrate diets. So what I did for him is to make sure that, okay, he actually knows what is actually causing his blood sugars to go really high in his diet. I tend to give people or my patients what we call a CGM, which is a continuous glucose monitor. So usually we use this mainly for patients who are type 1 or patients who are type 2 with who are multiple doses of insulin. But many a times I use it for pre-diabetes or patients who are newly diagnosed, just to give them an insight as to what is actually causing their sugar levels to go up. So it helps in terms of behavioral changes with their diet. So I gave him this CGM, and it tells you your glucose levels continuously when you're sleeping, when you're eating, and especially patients who have diabetes, it will show those big spikes when you have a big carbohydrate meal. So I gave him this for 2 weeks. I called him after a week and he was like, my God, it was so revealing that he more or less just cut down so many of his carbs, especially the rice. Rice was his main staple. He said every day was a rice meal. And the portion sizes, he literally just cut it down to almost, very small portions. So to cut the long story short, with the CGM, he was able to understand what in his diet was making him have these significant sugar spikes. And he cut all these down. His physical activity, he plays squash a lot.
Mm.
twice a week. He didn't change much of that, but
Yeah.
his diet, he changed that. And guess what? 3 months after, which was just last week, we checked his HbA1c and it was for
Well.
this was just from him understanding. It didn't, he really didn't have to have the CGM to actually know what to do, but
Yeah.
it made more sense to him.
Yeah.
I
Yeah.
actually seen it himself that,
Yeah.
oops,
When his
I'm
numbers
very
are,
high risk now. If
yeah.
I cut down these things, that just gave him so much motivation. So when he
Yeah.
cuts all those things down, he showed that his sugar levels on the CGM, which you will see in a graph,
Spike
was almost flat.
flat.
So he didn't even have all those big waves, and and of course the variation too is not a good thing.
Mm.
So all that variation and all that just went away for the almost flat uh, uh, graph. So that's one example. Yeah,
I like
that's
that.
one
And
example.
I think it's powerful on so many levels. One, it's a doctor. So you're not even thinking, sugar level. No. The second thing is the diet, the
Yes.
food and the CGMs, which we're going to talk a bit more about.
Yeah.
But I think sometimes little things, just changing his food, and it was
Absolutely.
such a huge foundation. So we're going to talk about that. So,
Yeah.
what does a diabetes reversing diet actually look like? I want you to be practical. What should people
Yeah.
eat? What should they reduce? And what does the evidence actually support? Yeah.
Okay. Right. So the evidence. So there was a what we call it a large study, UK PDS study many years ago, which looked at a big population of diabetes patients, and they introduced them to very low calorie diets. So they kind of reduced it to about a maximum of 800 to 1,000, I think less than 1,000 calories a day.
Yeah.
These patients or these people living with diabetes were put on this specific very low calorie diet
Mm-hmm.
for 3 months. They were already
Mm-hmm.
diagnosed with diabetes,
Yeah.
and by the end of the 3 months, over 50% of them had their diabetes reversed.
Mm.
So in the diabetes world, once upon a time, we never used to talk about
Reverse.
reversal. But now we know that is very possible.
Mm.
So the evidence is a low calorie diet. Now, the low calorie diet could vary.
Yeah.
In the NHS, we have a particular program called the T2DR program. We call it the Type 2 Diabetes Remission Program. And basically, what they needed to do was for 3 months provide these low calorie diets in form of shakes and soups, making sure that they don't actually, these shakes and soups give you enough energy for the day, but
Yeah.
you don't get more than 800 calories a day. And then
Mm.
followed up by a lot of support, you know,
Yeah.
you have like one-on-one kind of counseling and, physical activities just to support these patients.
Yeah.
So this T2DR program was specifically to help many patients reverse their diabetes. So
Yeah.
many GPs can refer to this program. And what you need to
Good.
do, first of all, is stop these patients they have to stop all their medications.
Mm.
So from their metformin to the SGLT2s, which are one of the common ones we use here, everything stops. But
Yeah.
of course, there's a criterion. Okay, you mustn't
Okay.
have more than 6 years, and you must be between certain ages of 18 and 65. So there's certain criteria because it can be tough.
Yeah. I can
Okay,
imagine.
it can be really tough. But the idea basically is if you want to reverse your diabetes, right?
Yeah.
Just cut down your calories. It sounds simple, and I'm not trying to
Yeah.
trivialize it at all.
Trivialize
It
it.
is
Yeah.
hard,
Yeah.
okay, but that is what you need to do.
Yeah.
Because if you do that, you are increasing the insulin sensitivity in your Okay. So
Okay.
insulin works better. You reduce that resistance, right? And then, of course, you will find out that you're losing weight with it because that's the idea. Once you
Yeah.
lose that weight, the insulin resistance is reduced and then your diabetes gets reversed. So it is doable. It is much harder if you're, say, 10 years down your diagnosis,
Mm-hmm.
because at that time you will have potentially started to have some insulin deficiency.
Mm.
Right. And it will be quite, it's not like it's impossible. So the best
Mm.
time is one, pre-diabetes when you're in that phase, or the first 5 years of your diagnosis.
Mm.
You're
Mm.
more likely to be able to reverse it. And this is by actually significantly reducing your calorie intake.
I know you had mentioned the numbers for the UK. I know
Yes.
for the US, we used anything below 5.7, you're good.
Yeah.
Anything between 5.7 and 6.4, you're
Yes.
pre-diabetic already.
Yeah.
And then anything over 6.5, you
Yeah.
are diabetic. From the pharmacy side, I know that the biggest helper for blood sugar sometimes is fiber. I know
Yes.
it slows down, it keeps you full, and it helps your body
Absolutely.
handle sugar better. And you can get it
100%.
from vegetable, beans, whole grains, nuts, and seeds. And I also want to say this clearly, your
Yes.
cultural food is not
Yes.
always the problem. So whether you eat rice or beans or okra, egusi, hummus,
Yes.
tofu, plantain,
Yes.
cassava, these foods can absolutely support your calories. But what matters is how you prepare them and what you pair them with. And that's why I
Absolutely.
created Meal Plan, and it helps you build meals that fit your culture, your medications, and your health goals.
Yeah.
Dr. Ladele, what about meal timing? Does
Yes.
intermittent fasting or time restricted eating have a role for people with diabetes?
Yeah, absolutely. I think you have to individualize it. But most importantly, when you're less active, right, that is when you should eat less, or the times you eat should be a little bit more, the hours must be a little bit further away from less
Okay.
activity and when you eat.
Okay.
So intermittent fasting is great, and there are different ways of doing it. The idea basically is you are more or less trying to reduce your total calorie intake at the end of the day. But in terms of the timing,
Mhm.
the best times to actually eat, right,
Yeah.
is when you know you could still do a little bit of physical activity shortly after. So I always tell patients that, your last meal of the day in the evening, or maybe a little late at night, not too late, you should try not to eat too close to bedtime. But very importantly, if you can just take a walk after you eat. So if you can actually uh, do some form of physical activity shortly after eating,
Great.
the better. If you try and delay sleep time from when you eat, the better.
Mm.
Intermittent fasting, however you want to do it, as long as your calorie intake of that day is being reduced, the better. So it's
Mm.
all about what goes in and how you burn it.
Yeah.
So if you do a lot of physical activity, you will actually burn most of those calories because your muscles, your cells are all needed, especially during active times. When we go to bed,
Mm.
everything goes to bed.
Rest. It goes to rest. Yeah.
Yeah, that's
Yes.
rest.
Yes.
So, and you will just find out the food you eat is just looking for where to hang itself. So it's
Yes.
stored in different places. So, uh, it, it is a good habit to have if you say, um, you take a walk, for instance, if
Yeah.
you can, just before bedtime, or you
Mm.
do some form of physical activity, um, uh, uh, at the last thing before bedtime, and it also
Mhm.
helps your sleep because sleep
Yeah.
is also very important. Sleep
Yeah.
also can affect, even the insulin with cortisol levels going up and all.
Yeah.
There's also that link to, because if you're stressed, that also causes a bit more cortisols to go up, and then
Yeah.
of course insulin also follows it because your body is stressed, it needs energy. Anytime insulin gets revved up in the body, that's alarm bells.
If you
Yes,
take medicine that lowers blood sugar, like
yes,
insulin or certain tablets, fasting
yeah,
without adjusting your dose can make your
yeah,
sugar drop too low.
absolutely,
And that, yes, that can be dangerous.
absolutely,
So make sure you're talking to your doctor or pharmacist before trying fasting. If you're not
yeah,
on this medicine, yes, fasting can be quite helpful,
yeah,
but always do it safely.
yeah.
So I'm going to ask, are there specific foods you see
Mhm.
that makes the biggest consistent differences in your patients?
Okay. So I always tell my patients, I try and keep it very simple. I don't like to complicate things. I tell them it's very difficult. A lot of our meals are ultra processed carbs or foods, high protein, vegetables. You said fiber in your diet
Yeah.
is usually the most straightforward way of going about it. Now, I always make a joke that if the food you're eating cannot be recognized by your grandmother or your
Mm.
grandparents, you know that there's more
More
processing
process.
done. It's
Yes.
more processed. And then you need to think twice whether this is what you want to take. Because what that means is more carbs, more calories.
Yeah.
And again, back to your point with, the fibers, reducing, slowing down gastric emptiness and
Ex-
digestion and all that. Many of these foods that are less processed will do that. And then for protein, protein's good, but I always say the best kind of proteins are the lean protein. So I say anything that flies and anything that swims. So your fish and all these seafoods are better protein than these four-legged animal type proteins. I would say white protein. So chicken, that's good. Uh, A very important point I like your listeners to actually take home is it's mainly the portion sizes. All right, portion sizes are very important. I'm not saying don't. Everyone likes to eat good stuff. You
yeah.
know, if if
Yes.
you look at your plate, make sure that carbs is the smallest part of the plate,
Mm.
especially if you have diabetes, because
Yeah.
that is your body is struggling to sort that out. Now, if it's the protein will help increase insulin sensitivity. It
Mm.
helps with your muscle mass and that actually reduces some insulin resistance in the first place. Long and short, low carbs, high protein, high veggies,
Lean protein. Yes.
and less ultra processed. What your
Lesser
grandmother can
portions.
recognize. Yeah.
That I like. I think I'm gonna use that with some of my patients. So from the pharmacy side, I
Yeah.
know that cinnamon, which appears in so many traditional kitchens from
Yes.
Nigeria to India to the Caribbeans, I know they genuinely improve insulin sensitivity based on evidence. And then magnesium, which is found in leafy greens, nuts, and beans, they help your body use sugar properly. So, and if you ever wonder whether a food is safe with your medications, my MediMeal Save app checks that for you. We have about 250 foods, 16 cuisine. It's like having a pharmacist in your pocket.
Yeah.
So, Dr. Ladele, can you share a story and a
Mhm.
patient whose dietary changes led to a measurable improvement?
Yes. There's one gentleman that comes to mind. He's actually 17 now. I've been seeing him for quite a while, for the last 6 months. So all of a sudden, he had symptoms. He had what we call osmotic symptoms, where you're
Mm,
peeing a lot, you're thirsty, and he started to lose weight.
mm,
And he did a test, and we found out diabetes, and it was very high, in the hundreds.
mm,
So, of course, that age, I was many things going through my mind. Can this just be diabetes? There's something not right. So, if an
mm.
elderly person should just all of a sudden have diabetes and the levels are very high, you have to think of something just out, not just diabetes, because it could
Yeah.
be something sinister like pancreatic cancer. As a
Mm,
rule, we normally just double check and do a CT scan and make sure that that is not why the person has all of a sudden become that. And that's, oh,
That
that's
age. Age.
advanced age. So this gentleman did a test and he was fine. His CT scan was fine. But because of how high his levels were, how symptomatic he was, losing weight and being thirsty, very tired, very miserable, I had to start him on insulin. Okay. So this was the first medication he started to get those osmotic symptoms down. And of course, once you're insulin deficient, one of the things that happens is that you start to lose weight because your body starts to look for where to get these sugar levels from. So he just starts breaking down everything and you lose weight.
Yeah.
So he had insulin for I would say about just 6 weeks. But very interestingly, he held on to the lifestyle advice I gave like his life depended on it. So this man all of a sudden took on cycling. And then his diet, one book I tend to recommend for some of my patients is called Carbs and Cows. It's just similar to your meal plans. He changed his diet and his lifestyle, especially with the cycling, as in so much so that within a short period of time, he was almost having hypos.
Wow.
And I had to it was one of the patients I can remember that it was I had to quickly take him off the insulin because he had made so much
Much
drastic change.
progress. So much progress.
He didn't need it.
Mm.
And that he is giving a talk at University of Warwick
Mm.
about the lifestyle, how within a short period of time,
A drastic
he
change.
the drastic change, and this was him just one. He took up cycling at 77. He said now everywhere he goes, he's never too old. Everywhere he goes now, he says, Doctor, I just cycle. I take my time, I cycle. But he significantly cut down his carbs because he said he didn't know he was drinking Coke like tomorrow. He was, they said at night he was always snacking. It was biscuits. He loves he has this sweet tooth. So he just cut all that. And by the time we checked his HbA1c again, his levels were just above the pre-diabetes level, and this was just I would say within 4 months.
Wow. Wow.
And that is even at that age,
It
that's
was
the power
reversible.
of,
Yeah.
lifestyle changes,
Yeah.
especially diet and physical activity.
Yeah. Yeah. I like the fact food also was medicine in action in terms of him reviewing what he was eating. It wasn't a
Absolutely.
supplement. It wasn't really a prescription. It was a decision he made.
It
And
was a decision.
also, other pillars, which is we're going to talk about movement, sleep, and stress. You talked about sleep and
Very
stress. We'll talk
important.
more about
Yeah.
that. The movement in which he was cycling. Food is the foundation, but diabetes is a whole body condition. And I know it responds to how you sleep, how you manage
Absolutely.
stress, and how you
Absolutely.
move the cycling.
Absolutely.
And
Absolutely.
I know that these pillars get left out on
Yes.
standard appointments most times, almost everywhere in the world.
Yep.
So sleep first, and
Yes.
then we're gonna go to the movement bit, which I like. How does poor sleep affect blood sugar and insulin resistance?
Okay. Thank you. That's a very good question. So I think sleep, we underestimate the importance of sleep for so many things, not just diabetes, but specifically for diabetes. We know that if one has poor sleep, right?
Yeah.
In terms of, and sleep is, the quality and, the quantity, very
Yeah.
important. This actually affects stress hormones, and the commonest stress hormone we know about is our cortisol levels. If we don't have a good sleep, that our cortisol level rises. Once the cortisol level rises, the cortisol is a hormone, kind of like our flight and fight hormone. So it's like something is about to happen. You're stressed, and you need some hormone to alert your body to get into action. What the body also needs, once that cortisol level goes up, is it needs energy to be able to combat whatever fear or action is about to happen. So cortisol levels we know will cause your insulin levels to rise in the body. Now, once these insulin revs up again, I always like to use rev because it's like when you're in a car and you're not moving, you're just revving your accelerator, maybe the handbrakes are up, you're burning unnecessary fuel, but it's not moving. This is the same thing with insulin. When you're not actually moving or needing sugar levels to fuel your muscles, you are just revving your insulin levels. They're just going up for no reason. Cortisol is one of those things that will make these insulin levels rev up. And once you have high insulin levels in your bloodstream, then it's like a vicious circle. So the sugar that you have in your blood cells or in your bloodstreams, the insulin should help get them into the muscles and all. But if there's no activity going on, you're sleeping. It will just cause lots of fat deposits around the body, and then you get more insulin resistance. So in summary, just to make it, just to simplify it, poor sleep, high cortisol, which is your stress hormones, and that causes a rise in insulin, causes more insulin resistance, causes less insulin sensitivity. And then, of course, what do you get at the end of it? You get diabetes, you put on weight, you know, and you get more inflammation. So inflammation is another thing that, when once these stress hormones come up to your cortisol levels, it just causes undue inflammation in the body. And all these things are detrimental to the cells of the body. So sleep so important that we try as much as possible to get good sleep. It's hard sometimes, but we have to. There are ways. You mentioned magnesium. Some of my patients swear by magnesium to help them sleep.
It does.
So that's another thing too. But there are also many, shall I say, sleep hygiene measures. One of the things like I earlier spoke about is a little bit of exercise before you go to bed.
Right.
That helps you have a good sleep.
Yeah.
But there are many things, of course, depending on the individual, depending on, of course, females of a certain age, when you get towards perimenopause and menopause, that could be an issue too. But there are things you could do to help manage that. So, very important. I cannot overemphasize the importance of sleep and stress, basically.
Even one bad night of sleep, it can make your body handle sugar poorly the next day. And many people with diabetes also have sleep apnea. It could be loud snoring, gasping, waking up tired. So talk to your doctor so you know the difference.
Sleep apnea. That is important because we now know that if one has sleep apnea, that is actually a red flag to say, oh, you might be having other metabolic or cardiovascular problems.
Yeah.
So it's very interesting that, of course, this day and age of the Monjaros and Ozempics. So in the UK now, for you to be qualified to have Monjaro, which we use for diabetes and for weight management. Yeah, for you to be qualified for that under the NHS and not paid privately. One of the things is sleep apnea. So you have to have 4 out of 5 things. So sleep apnea, hypertension, type 2 diabetes, raised cholesterol, and then your BMI of greater than 30. So interestingly, sleep apnea is one of those.
It's one of them.
Because we know that it's kind of like these things are kind of like brothers and sisters. They roll together.
They work together.
Diabetes will carry hypertension, it's to carry obesity, it's to carry sleep apnea and all that. So if you manage one, you're managing
the others.
The others. Very important.
Yeah, it's quite important, yes. And I think people should get tested.
Absolutely.
And treated so it can make a huge difference, like you said.
100%.
And I know you mentioned stress too. When you're stressed, your body releases sugar into the blood, and even if
Absolutely.
you haven't eaten, and that's why stress management is not optional. It's part of diabetes care. You mentioned movement, and I remember the patient, the 70-something-year-old patient that
Yeah.
you had mentioned that
Cycle.
circled. So no, it's a good thing. I think
Yes.
we tend to forget
Absolutely.
sometimes that it should be part of our lives, but sometimes we get carried away. Exercise, I think it's medicine, and I think
100%.
the dose is lower than most people think. I think when muscles contract, they pull glucose from the bloodstream
Absolutely.
for energy without needing insulin. So, like you said, even if it's a 15-minute walk after a meal, it can actually reduce your post-meal blood sugar spike
100%.
significantly.
Yeah.
And that's accessible to anyone, anywhere in any country.
You're right. You're right. Yeah. You're right. Yeah.
Movement is medicine. Walk after you eat. It would help lower your blood sugar. You don't
Yeah.
need a gym. Like Dr. Ladele said, you can walk.
100%. Yeah.
Dancing, gardening, it all
Lots of
counts.
things. Yeah. Physical activity, I call it. So another thing I tell patients is you can snack on physical activities. When
Yeah.
I say snack, you go somewhere there's an elevator or escalator.
Mm,
Don't use that. Use the
mm,
stairs.
mm,
Snacking on that. As a rule, I don't use elevators.
mm.
Except I have lots of suitcases or it's going to 100 floors. But if it's
Yeah.
like 10 floors, 9 floors, use the stairs. You're snacking
Mm,
on that. If you go to buy your grocery or you go to a mall, try and park very far away from the
mm.
entrance. Use that as a bit of increasing your steps for the
Exercise.
day. Those little bits of snacking, and you need to just incorporate it into your day so that by the end of the day, you'd be like, oh, you've done 10,000 steps without
Mm.
you even physically
Knowing that
going to
you've
the gym,
the gym.
you know? So, there are many things we can do. And what was very common to all of them was they're very healing. So everyone,
Mm.
I mean,
You have to
uh,
work.
they have to work, whether you like
Mm,
it or not. You
mm,
know, their meals are mainly just plant-based meals.
mm.
And very interestingly is the community feel. No one was
Mm.
going to a care home or anything. They didn't have care homes.
Mm. They
It
don't
was
have
just
that
that community,
community. Yeah. Yeah. Quite
and
important.
very important.
Mm.
And with the stress we're talking about, that community, of course,
It
which
reduces that.
it reduces all those
Mm.
stress. So
Yes.
you can't overemphasize the importance of many of these things outside of medications. Medication has its role, but lifestyle for me is key.
This is what whole person care looks like. And these changes just don't improve diabetes, they actually improve everything. So if your
Absolutely.
sleep, if your energy, if your mood, if your heart, if you have a community, you're just not reversing a diagnosis, you're actually transforming a life. So now we're going to talk about how to put it all together. Because I know we've talked about, because medication supplements, like you said, they have a role to play. They
They
have their
have
own
a
place. So I want to name something clearly. This is not conventional medicine versus holistic medicine. It is both, because the best care holds both at once. We have the evidence-based medications when they are needed, like you
Yep.
said, and root cause lifestyle interventions working alongside them. So they work hand in hand. So for your clinical experience, when do patients genuinely need medications? When is the medication the right answer, not just the default?
Okay. So thank you very, very much for that question. So in my diabetes clinic, okay, so my approach, so I have what we call an ABCD approach to managing my patients. And each alphabet has a meaning. So the A, the A is advice on lifestyle.
Okay.
So this is where I talk about diet, physical activity, you know, sleep, hygiene, you know, community and all that. So a lot of the advice, that is where I start from, because I know
Mm.
to me, that's the most important thing. Okay. So I tell them, I said, look, there's some things I can help you with, but there's some things that I can't help you with. You have to do it
Yeah.
yourself,
Yeah.
but I will give you the information about it.
Mm.
And this is mainly lifestyle. Now, once we have established that and we've spoken about that, then comes the other stuff, because some patients, of course, lifestyle alone will not be enough.
Yes.
There are lots of patients that have a very strong family history, and you can't change that.
Mm-hmm.
You know,
Mm-hmm.
some people, because of where they're from. So, like in the UK, for instance, if I have a South Asian coming to my door, I know that they have 4 times the risk of having diabetes than their
Mm.
Caucasian counterpart.
Mm.
Now, they can't do anything about that, but
Mm.
they can do what they can do in terms of lifestyle. But lifestyle, for many of some of those patients, is not enough.
Mm.
And then comes the conventional medications that we use. So the medications do have its role. So I start off, lifestyle is the base, and
Yeah.
then you can then build up if you do require medication. So please see your doctor if a lifestyle alone isn't doing the job, because there are very effective medications out there that will not only just help the diabetes but also help protect other things that diabetes can affect.
So over here in the US, I know we talked about the HbA1c, but we call it A1C here.
Yeah.
Normally, if it's above 9%, medications are not optional. High blood sugar is toxic. So, like you said, it does damage the blood vessels, the
Yeah.
nerves, the kidneys, and the eyes, which you talked about. Things you
Yes.
have to do, your ABCs. I like that. I think I'm going to start using that.
That's all right.
We need
I
to
didn't
lower
coin
it.
it. I don't want to take glory for it. It's one of my mentors, Professor Vinod Patel.
Yeah,
He coined that. He's a professor of diabetes in
I
general
like
public
it because
health.
it
Right.
makes it simple.
He makes it very simple, and yeah, he makes it very
So,
simple.
like, here is what I want every listener to hear. Starting medication is not failure, just in
Mhm.
case you think so. You mentioned
Abs-
metformin, the GLP-1 receptor agonist like semaglutide, Ozempic, or
Yep.
Wegovy
Yep.
over here, and the SGLT2s like Siga. These are powerful evidence-based tools, and we use them when you need them, you
Yes.
know. And if you do make real sustained lifestyle changes and reverse, so never stop taking your diabetes medication without speaking to your doctor.
Yeah.
If you're making progress, have that conversation. I think you deserve to. The supplements also like berberine, magnesium, alpha lipoic acid. What is your take about that? What's your perspective of that?
Magnesium and vitamin D. Vitamin D, I know there's good evidence
Mm.
that, vitamin D supplements do help just general well-being. And as we mentioned before, magnesium helps, good sleep. And
Yeah.
they certainly have a role, but you have to be very careful. There are many of
Mhm.
these supplements that, they might even cause more harm than good. So
Then
you have to be very careful,
careful.
especially
Yeah.
the effects on the kidneys, especially the effects on the liver.
So you mentioned magnesium. That's the funny thing. I was actually
Mm.
going to mention magnesium and berberine, but you got to be careful because they can lower your blood sugar. They can lower it if you're taking too much of everything together. So you
Right.
got to be careful if you're on diabetes medication. Always check with your pharmacist first.
Yeah.
And my book, Foods That Clash with Your Prescription, explains which foods and supplements interact with common medications in simple language, and it's at pharmaplansystems.com. So now we are going to talk about what you've been mentioning all along, CGMs.
What?
We have two or three. Crystal is a common one here. And
Yes.
we have another one called Dexcom. You use them with your patients.
Mhm.
How has it helped so far? What
Right.
are the clinical values it
Okay.
gives?
The continuous glucose monitors are, for me, a game changer. If I was the head of diabetes in the UK or globally, I would say if you have diabetes or have type 2 diabetes or pre-diabetes, here you go. However, it's expensive. All right. And,
Mhm.
you have to look at, the cost benefits side of it. But what it does, like I explained earlier, it just informs your dietary choices, okay, in a very, very clear manner that you yourself, you can't but notice, or you can't ignore it. You
Yeah.
know, if you have a meal and then an hour after, you can see what that meal has done to your glucose levels.
Yeah.
And that has helped a lot of my patients. You know, and even if it's just intermittent use, you don't need to use it all the time. But if you know you are at risk, or you have pre-diabetes, or you have a strong family history, it's very good to actually just try it out. You know, it's, yes, you know, some people's like, oh, I don't like, you know, needles in my arm or anything.
The failed
It's
needles. Yeah.
the, you know, the phobia, but trust me, you hardly feel a thing. I've used it myself a number of times, and it's so informative for you as an individual to actually see, even when you do exercise, what happens when you have a protein meal, what happens when you have a
Mhm.
high carbohydrate meal, what happens, and you just then make the right choices when anytime you want to eat.
Yeah.
You know, even with even drinks, you know, especially, you know, alcohol, what it
Alcohol.
does to your body, and everybody is different. Everybody's metabolism is
Yes.
different. I might eat a small bowl of rice, and another person might eat the exact same bowl of quantity of rice, but what my sugar levels, how high my sugar levels will go, it will be slightly different from the other person, because our bodies metabolize these things very differently. So it's
Mm.
a good idea to know for certain how your own body deals with, you know, certain meals that you consume.
Yeah. I totally agree. I think the
Yeah.
CGMs are game changers
Yeah.
for diabetes testing because the real time feedback is
Yeah.
extraordinary. You can see
Absolutely.
exactly how
What is
you
going
take a
on?
bowl of jollof rice. Yeah, you take a bowl of jollof rice,
Yeah.
how it affects your blood sugar versus a bowl of egg and vegetables. How
Exactly.
when you walk after dinner, it lowers
Yeah.
it. How a stressful day
Absolutely.
spikes. Even
Mm.
without eating, if
Yeah.
you're stressed, you can see it. And I
You
think,
get exactly good points. You know.
yeah, and I think that data empowers you. I don't think it's about perfection. I think it's about awareness. And I CGMs, they are expensive, but they're accessible. And I know that in some of this company offers coupons that you can
Yeah.
use if you're type 2 diabetes or if you're pre-diabetic. I
Mm.
think in the
Yeah.
UK, I was looking at something, I think a NICE or
Yeah. You can get
NIC,
free
they've
ones. Yeah.
expanded eligibility. Yeah. So I
Yeah.
think talk to your doctor. That's what I would say. Talk to your
Yeah.
doctor about whether one is right for you. But I do think it's going to make a huge change
Absolutely.
in years to come.
But you know
So,
what? Sometimes I always tell patients, buy it yourself.
yeah.
And you
Yeah.
just probably just now, like the freestyle Libra, which I commonly use, that one will last you 15 days.
Mhm.
That's enough
Yes,
for you to
yes, yes,
know
yes,
what, you
yes.
know,
It's
what
happening.
kind of
You don't have to poke
mm,
every day. Like
exactly.
you said, it used to be
Mm,
10 days, but now it's 15, which is
mm,
good. So just
yeah.
twice a month is only
Mhm.
when you have to change it.
Exactly.
You have it on your phone. You can, if you
Yeah.
download the app, you can easily just
Just have
look
a
at your
look at it, you
numbers.
know,
Yeah,
as you go on, you
yeah,
know, real
yeah,
time, every minute it's telling you what your sugar
yeah.
levels are. So I think down the line, I think once it becomes more, because there are many companies that are producing it now, and I suspect that in few years to come, it will be more readily available,
Available,
and
not
it
as
will be,
expensive.
yeah, one of them, yeah, not expensive. And it
Mm,
will be one of the mainstay of treatment, because
yeah.
right now, even in the UK, it's the eligibility criteria is a bit, you know, it cuts out a lot of people. But I
Mm.
think we should even at some point start to even offer it to people who have pre-diabetes.
Yeah, I do agree because then it can
Mhm.
prevent full blown
Exactly.
diabetes. So, the last question, what do you say to patients or caregiver who has all of what we've spoken about today and they still feel completely overwhelmed? What do you say?
Right. Yeah. So yeah, that's a tricky one, because you know, I remember each time I have to give that diagnosis of diabetes to a patient, I could see how their shoulders just drop and they
Drop.
feel like, oh my God, am I going to die? But I would say diabetes at the moment is, you could live a normal life. All right. As a Diabetes UK clinical champion, what we normally say, or what our slogan is we always say that we want a world where diabetes does no harm. And it is actually possible for the diabetes not to have any harm. So we used to once upon a time say, oh, patients are my diabetic patients. We try and even, because it kind of, there's a bit of stigma to some of these illnesses like diabetes, and everyone will be pointing fingers. You know you're diabetic? Why are you eating this? Why are you eating that? One of the things we're trying to do is to debunk that stigma, and we've even changed how we refer to diabetic patients, and we say people living with diabetes. We have to normalize it, because there's almost 500, and the last I checked, 500 and almost 590 million people globally living with diabetes. That is huge. And by the year 2050, that figure is almost getting to almost 1 billion people living with diabetes. So it can sound very overwhelming, but my message to you is there is so much you can do to actually live a normal life where diabetes actually does no harm to you. But a lot of things you can do apart from medications are in your hands. It can be a bit difficult at the start, but there are many resources around that you could actually engage with to actually help you, to manage these lifestyle changes that will benefit you at the end of the day. So in summary, I will say, don't be overwhelmed. There's help out there, speak to your doctor, speak to your pharmacist, there are lots of resources out there. There are many books. There are many, like this kind of show, this kind of podcast, to actually help you understand what diabetes is about and how best to manage it. And I could tell you for certain that regardless of your age, regardless of the family history, and some people say, oh, everybody in the house has diabetes, and they just feel like, that's it, it's caught me. There's nothing I can do, Regardless of all that, there is something you can do. There are medications now that are so effective, even much more than even insulin, So I would say, don't be overwhelmed, get help. There's help out there, but you need to be very intentional, especially with some lifestyle changes.
Yeah, I do agree. And I think what you said is true, and compassionate about not labeling or, putting a stigma on people that are diabetic. You don't have to do everything at once. You can start with one thing. It could be a
Absolutely.
walk after dinner. It could be a different breakfast. It could be just going to bed 30 minutes early. So small changes done consistently, you build a foundation. And this is where transformation begins for everyone, everywhere. So we're going to do something called rapid fire. I ask you questions and you just answer. Okay?
Okay.
You ready?
Yeah, I'm ready.
Okay.
So these are
So
the kind of questions I don't think about. I just
think you
say
just
what comes.
answer, but I hope we help somebody though. Okay, so first question: one food that stabilizes blood sugar every single week.
Ooh. Stabilizes blood sugars. I would just say veg. I like broccoli. Just
Okay,
eat broccoli.
that's something. Okay. Number two: best time of the day to exercise for blood sugar control.
Best time of the day, I think it will be later in the day. So as you're winding off your day, in the evenings, 7 o'clock, 8 o'clock, not too far away from the time you go to bed.
Okay.
Personally,
Supplement you reach for in a newly diagnosed type 2 patient.
magnesium is a good thing. Vitamin D is a good supplement. Yeah, those are my two, I would say.
Okay, so biggest lifestyle mistake you see most often in your patients.
Lifestyle mistake. I have a lot of patients that just say, okay, I don't eat much, but I like my Coke, and they drink a lot of Coke. I think, okay, that's probably not a good idea.
That's not good.
So
That's
yeah,
not
so
good. Yeah.
thinking that
Okay.
drinking is less of a problem than
Then eating.
having calories in your food is probably what I'll say.
Next question. Can you reverse type 2 diabetes? Yes or no?
100%.
One thing you wish every newly diagnosed diabetic knew on day one.
Day one, diabetes can be reversible.
Should people with diabetes try intermittent fasting?
Yes, I would recommend it because it does work if you can do it and if you could, fit it in with the kind of job you do. Yes.
Okay. Can stress alone raise your blood sugar?
100%.
Best
Yes.
snack for
Yeah.
stable blood sugar, one that works in any cuisine.
Best snack. Nuts.
Okay. So I'm going to say complete this sentence.
Okay.
The most underrated tool for blood sugar control is
The most underrated what?
for blood sugar control.
The most underrated tool, I would say, is the CGM.
CJ. Okay.
Yes.
Well, good. So I think for all the questions, I think I like the exercising
Yes.
before bedtime if you can.
Yeah.
I love all of your answers though, but I think that's one missed opportunity that people don't know or think about.
And like I
Sure.
said, it doesn't have to be exercise as in a
As
structured
in
type of
exercise.
exercise. Some form of physical activity. It might be a good time to just say, okay, this is when I want to even water my garden. At night time, just do a
Yeah.
little bit of that. Or just take a bit of a
A
walk.
stroll. Yeah.
Walk.
Yeah. So that's gonna go on every diabetes discharge letter as far as I'm concerned.
Yeah, absolutely.
Yeah, I think it's
Yeah, strolls are
I don't
good.
know if,
Yeah. Because
yeah.
one of the things I do now, of course, with this day and age of audiobook, that's when I read. That's when I don't read. I do a lot of audiobook listening.
Yeah.
So I incorporate it with my walks. So
Okay.
if I'm really interested, I'm listening to something and I'm really interested and I want to keep on doing it, it makes me get up and walk. So that's when I put up my headphones and I just do a bit of walking and that helps. And I recommend that to lots of my patients, which they are thankful for.
I think you answered my last question, but I'll still ask it. So maybe you have a nugget you're going to share.
Right.
My question is,
Yes.
I want to give you the last word. If there's one message you want someone with diabetes or pre-diabetes to take away from everything we said today, what would it be?
I've said a lot, but what I would say is be kind to yourself. Try not to look at diabetes as one monster that cannot be dealt with. But most importantly, be more intentional in some of these lifestyle changes we've discussed today.
So I like that. Be kind to yourself. It's very important. Be intentional. And that's what I will want you to carry from today, wherever you're listening, whether you're in the United States, the United Kingdom, Nigeria, India, Jamaica, Brazil, or anywhere in between. Diabetes is not a life sentence. It's not something that was simply handed to you. It developed over time. It could be through genetics. It could be environment. It could be your food. It could be stress. It could be circumstances. And for so many people, the trajectory can change. You have more power in this than anyone may have told you. Through food that works with your body and culture, sleep that genuinely restores you, movement that fits your life, stress that you actively manage, and medications when you need them. You can change what this disease does in your body. So start with one thing, not everything at once. One walk, one different meal, one earlier bedtime, small changes done consistently. Build the foundation, for real transformation. I've seen it happen. Dr. Ladele has seen it and is seen it happen and it's real. So, Dr. Ladele, you've given people across the world real hope today and real tools. Where can people find you and learn more about your work?
Well, thank you. It was a pleasure being here. I'm based in the UK, but I also provide private consultation through my partner's Dr. Finley's private practice. I do online consultations and face-to-face consultations. So wherever you are in the world, I could have online consultations with you. I have many clients back in Nigeria and quite a number, even in the States and in the Middle East. So Dr.
Mm.
Finley's private practice. You could also check me on LinkedIn. You get most of my work that I do with Diabetes Africa and Diabetes UK.
Okay, so we're going to share Dr. Ladele's information in the link notes. You can get it from there. Before we close, if today's conversation opened your eyes to how food and your medications interact, I'm going to give you two places also to go to. First is my book, Foods That Clash with Your Prescriptions. And second, my MediMeal Save app. Check any meal against your medications in real time. We have about 250 foods, 16 cuisines, including Nigerian, Caribbean, South Asian, and Mediterranean, both at pharmaplansystems.com. And all the links will be in the show notes. You can find Dr. Ladele easily too. So everyone in listening, thank you. Thank you for showing up for your health and for the people you love. And if this episode helped you in any way, share it with your loved ones, share with family who was probably just diagnosed, with a caregiver who needed to hear that it can get better, with a friend who's been managing this alone. Subscribe on Apple Podcasts, Spotify, YouTube, so you never have to miss an episode of When Food Meets Medicine. Until next time, eat smart, your meds matter, and your body will love you for it. Take care, everyone.